The anatomy of the respiratory system. When we inhale, air is conducted or moved through all of the organs of the respiratory system. Over the next few slides, we will follow an inhaled breath all the way to the circulatory system. The breath enters the nasal passages, nose, and/or the oral cavity, mouth, then goes to the pharynx, throat, the larynx, voice box, the trachea, windpipe, and to the lungs. The lungs are enclosed in the thoracic cavity, the membrane-bound compartment inside the ribcage along with the heart. Inside the lungs, the airway branches continuously. The trachea branches into bronchi, large airways, then bronchioles, small airways, then alveoli. The diameter of the airways decreases at each branch point, and the surface area to volume ratio increases. The alveoli are tiny sacs at the ends of the bronchioles that are the site of gas exchange between the respiratory system and the circulatory system. In the diagram below, oxygen-poor blood carried in the capillaries is represented as blue. Upon contact with the alveoli, the CO2 diffuses out of the blood and into the lungs to be exhaled, and O2 in the lungs diffused into the blood. Is it better to breathe through your mouth or nose? Larger volumes of air can be transported to the lungs through an open mouth and may be required during intense exercise. At other times, however, nasal passages have adaptations that give nose breathing more health benefits. When you're not thinking about breathing, you are almost always breathing through your nose, unless there is some obstruction or disease that is forcing you to breathe through your mouth. Nasal passages adjust the air temperature before the air hits your lungs. They have cilia, short hair-like structures that filter the air before it gets to your lungs, removing dust, allergens, viruses, and bacteria. They're better adapted to humidify the air you inhale, so your throat and lungs won't dry out. And they have smell receptors that allow you to detect things that could be toxic, or things that could be attractive. The nasal cavity is pictured on the right. Air is breathed in through the nostrils, where nose hairs and mucosa trap potential pathogens, harmful microorganisms, in the air. The turbinates help to warm and humidify the air, as well as cause the air to become turbulent, which means to swirl around, allowing more pathogens to be caught. The olfactory mucosa traps chemicals for smell, and the tonsils house white blood cells to fight off pathogens.